Hello, and thank you so much for taking the time out of your day to spend some time with me. My name is Michelle Strange, and I'm a dental hygienist, and I am working on my 22nd year in dentistry. I have personally been an on job trained assistant, a perio hygienist, and a surgical assistant. And I've also worked in outreach programs that had a very transient environment, which is kind of what kickstarted my love for this particular topic. In that situation, we had providers who would come for like just one day, and they would be there and be gone the next. And then some were regulars. And that type of clinic really showed me that just because you have two thumbs and a dental degree does not an infection control expert make. And now I am temping as a dental hygienist. And though I know how to do my job in patient care, I still need to know how to perform in your practice. So you see, I was practicing before I was a temp in many clinics for years at a time with very little turnover. And I very much developed a mindset that the way we did dentistry is how everyone did it. And that is just not the case. And even though the CDC, OSHA, EPA, FDA, and so on gives us guidance and recommendations, it doesn't always mean that each office does it the same way. And I've been in so many practices or have providers come into my outreach clinic that I used to be in. And let's say they look at the equipment that I thought was pretty standard, but they would have no idea how to use it, clean it, or sterilize it. And now that I have committed to this life as a dental hygienist and infection control expert, I see now we have a big issue in our industry, and that has been amplified over with current staffing issues. So many offices assume that if you have this dental education, you know how to perform it all infection prevention and safety procedures. And I'm just here to tell you guys that's just not true. Just because I'm a hygienist, this does not mean that I can be inserted into every office and be sure to practice safe dentistry. There are some very important details that I need to know. And as I temp, move around, I ask these offices, do you have these instructions for operatory turnover or whatever in, writing? And they look at me like, what? I'll ask the office manager, where can I find your standard operating procedures for the, sterilization center so that I know how to properly clean, disinfect, and sterilize the items we use for patient care? Want to know how many people have been able to give me those SOPs? Zero. A big fat goose egg. And so I spend my time as a temp asking, I'm bothering and hoping for the best to find things. I'm opening drawers, I'm opening cabinets, trying to sort it all out on my own, which in turn delays me and takes my time from other important aspects of patient care. So today I am going to highlight the importance of having standard operating procedures, especially during a time where so many practices or facilities are struggling to find team members. And so we're going to chat about SOPs, having a safe culture in the practice, and then we're going to focus on a very important area of your practice, the sterilization area. I'm going to review the things I need to know about your practice if I am going to temp there. I just want to say thank you to Tuttower for the opportunity to discuss this with you today, as they have provided the honorarium for my time today. So I don't think this comes as a surprise to anyone. We are, as an industry, understaffed and facing a shortage of team members. This has actually been a really fascinating time to work, I must tell you, because I personally was practicing back in 2008, 2009, where I saw my colleagues in offices that had like 4 columns of hygiene get cut down to 1. We were, people were desperate for jobs then. And I personally was micromanaged if I was using more than 2 pieces of gauze on my tray for patient care, because times were tough and there were not enough patients coming in to even keep team members. And so everyone was looking for a job. And now I'm working in the flip side, or we are all working in the flip side of that coin, where we have a shortage of people. And there are many reasons for this shortage. I have my own opinions about it, but the reality is team members are working hard to make up for the shortage. And we are even bringing in people with zero experience just to have someone help us see the patients who are in need of dental treatment. People are getting burned out, and the issues we saw in the way of cutting corners before the pandemic, they're amplified now. So when I roll into an office as a temp, I'm asking anyone who's around, where can I find trays and tray covers and sterilization bags? And some of them are as helpful as they can be. And by that, I mean, some people are just so frayed and tired that help is minimal. And I'm just bugging them, really. So I'm left to figure it out. And in a medical setting, we cannot just figure it out and hope we're creating these safe dental visits that we are obligated to create. So one thing I always notice in a practice when I start asking questions about their infection control practices is their safety culture or culture around safety. Some sources have cited that the culture, that just developing a culture is widely accepted as almost like that would be nice to have, but it's not really seen as a vital aspect of doing business in medicine. Culture is a shared experience. It's very much a group phenomenon, and it really does impact many levels, and it's very dynamic, and it really is essential to creating safe dental visits. By its nature, culture requires action to be intentional. So I ask you, are you and your team members being intentional in your infection control practices? Is there intention to be safe, careful, and make great efforts to ensure everyone knows how to create safe dental visits? And I understand this is hard when you're tired, when you're burned out, when you're barely even finding time to eat lunch or take a restroom break. It's hard. And it needs to be said that the culture of safety begins with leadership, where it's imperative that leaders work to align the entire organization's safety culture with evidence-based information, with capable, knowledgeable employees, and appropriate resources. And cough, cough, that would be standard operating procedures. And in dentistry, as in all healthcare, the need for a robust patient safety culture is truly the first dimension of quality improvement and care. And we have to make it particularly urgent as the highly technical nature of dental work often leaves its patients vulnerable to errors. And sometimes this results in harm. And we're not here to do that. That is why I also choose to look at our sterilization center as the place to focus our attention today, so that we can ensure that any new team member or temp employee, we're not causing harm just because we didn't know, or we didn't know your flow. We didn't know how to do it in your practice. I don't think any of us are going into this to create harm. So we want to make sure that our safety culture is on point. So I want to start off with the CDC, because they've been saying for years that we must make infection prevention a priority, and that every office should have at least one person as the infection control coordinator. We need one person that's going to be tailoring policies to each dental setting. And we want to make sure that we are reassessing this on a regular basis. So let's dive into two of these very important recommendations from the CDC. So the infection control coordinator and why training should be unique to the practice is where I want to kind of jumpstart this. So I want to be very cognizant, because I understand that keeping up with products and infection control recommendations, it can feel overwhelming. I know it's overwhelming. I've done it. Infection control breaches, though, they create tremendous liability and potential for harm, and they can jeopardize our licensure. And so the CDC recommends that every practice have this ICC or the infection control coordinator to help prevent those breaches. And so assigning oversight responsibility to one person helps improve the compliance and provides continuity, so you don't have product changes every month. And I like to, kind of liken this to if you had one person doing your ordering. If you had everybody ordering stuff just whenever it ran out, we probably we'd be spending a lot of money that we don't need to be spending, and it wouldn't be very efficient or organized. And so if you have an ICC, that one person that's the champion over the infection prevention protocols, we have some continuity and we have some organization and efficiency with our infection prevention protocols. And the ICC can aid in developing your exposure control plan and safety training for your new hires. And they can also add to a level of assurance for patients who are often looking for visible evidence of infection control and safety practices. And the ICC should be a team member who shows attention to detail and willingness to learn. This is not somebody that Michelle's there every day, so she can be the ICC. No, I might not have any ability or any desire even to look at all of the record keeping and understand the nuances of infection prevention. So you want to assign this to somebody who actually wants that job and has the desire to do it. It also does not mean that when you go to the office and you tell this new team member this is their new job and then give no additional time to perform these responsibilities. The ICC schedule should have time allotted to successfully implement the infection control program and should also attend courses and have proper training. And I know this might be difficult at first because we're already shorthanded and we're struggling to find the time in the day to get everything done. So if you can give this role the time it needs, it will pay off and end up saving time and money and potential aggravation in the future. And y'all, we are coming up on 20 years since the CDC told us that every practice should have an infection control coordinator. It's getting downright embarrassing how slow dentistry is sometimes to change, especially with a role as critical as this that can keep patients and team members safe. So assign one today, and you can always connect with me after this if you want to chat more about it. So I ask you, who can take on these responsibilities, be the leader to help create the safety culture in the practice, and would be my go-to person if I have infection control questions while temping in your practice? Okay, so let's go diving into our standard operating procedures and what that looks like for your sterilization center. So I'm your temp hygienist, and I need to know a few things so that I can practice safe dentistry in your office. And I cannot say this enough. Just because I have 2 thumbs and a dental education does not mean that I can practice safely in your practice. Yes, can I complete tasks that prevent infection control breaches? Yeah. But to understand the nuances of infection prevention, that takes additional education. And even with my additional education that I have in this space, I still roll into an office and they have some chemical that I've never used, or they have a different type of sterilizer that I'm not used to, or their chemical indicators look different. And I don't know if this is a 5 or a 4 and it needs to go inside the package. So just because I know how to practice safely and put a scaler to a tooth without harming the patient, it does not mean I will know how to prevent infection control breaches in your practice. So I need you to tell me how I'm going to practice safe dentistry in your office. And that can start with giving me your standard operating procedures. If you have ever listened to any of my presentations, you will know that I am a huge fan on SOPs. I live for them. I like to make sure all directions, even when I'm making them, because I make them for offices too, I want to make sure that the directions are clear so that there's no question about what we need to be doing, how often, and what products are being used. Standard operating procedures are fantastic to have for your new hires or these temporary employees that we have currently in all of our practices. I mean, I personally have not walked into a practice or spoken to anybody who has not had some level of turnover right now. And so if you can just give them, you can even do this digitally. I could have this before I enter your practice and have everything defined and concise. And that way we can eliminate any errors because I have it all there. So SOPs help stop legacy errors. Legacy errors are things that occur in our industry. We are actually very much riddled with a lot of legacy errors, where we're doing things with old knowledge and passing that on without asking questions and without updating and without doing proper training. So we've got to get after those legacy errors, and SOPs are created and then updated as the office changes. They define the why, the what, the when, the who, and the how we are performing tasks in our practices. So if I create one for instrument reprocessing, I will define the why. Then I'm going to specifically call out what we are doing. We transport, we clean, we rinse, dry, package, sterilize, and store our reusable patient care items. Define it all. Then I defined everything from how much solution to water someone will need to use in our ultrasonic, to how many degrees water temperature it needs to have in the morning, to how I test it to ensure it's working properly, to remove the bioburden. Then I explain where we dry them, how we package our instruments, including instructions for the types of instruments like our hinge instruments, our cassettes. How do we package those? What chemical indicators do we put in with all of those? Then I even explain how we load our autoclave, and I will talk about that. But if I had $1 for every time I read on Facebook, is it paper up or plastic down? Y'all, I could have retired 10 years ago. So they cannot be packaged all the same. So we want to make sure that we know how to load our autoclave. So tell me these things. Then I would name who's in charge of getting the sterilization center up and running in the morning. Who does the instrument packaging? Is it everybody, packages their own, or is there a specific person? And you might be thinking, this seems ridiculous, but remember, I don't know how to work in your office, and I'm here to tell you everyone does it differently. I was recently in a practice where the dental assistant straight up told me, do not touch her stuff. She liked it packaged a certain way. And since I was an ortho and surgical assistant, I don't know most of the instruments in a general practice. And I was all too happy to oblige when the assistant tells me to stay away from their turf. I'm happy to do that. But on the flip side of that is that if I leave instruments because I honestly don't know what they are or how they should be packaged, I could be seen as a diva hygienist who doesn't help. Or I could do it incorrectly and create an infection control issue. So please tell me who and the how and all of the details. The how is important, especially if you have a transient clinic or you have temps in the office pretty routinely. So write out the steps. And as someone who has created so many standard operating procedures, it feels annoying to write it all out. But it will save you so much time when there is anyone questioning the why, the what, the when, how, or anything. It is your source of truth. So write it all there, because it is the place that you need to come back to. That is your source of truth, especially in the sterilization area. And we want these SOPs to be specific to your practice. Though it may feel like, since we have similar equipment and that it all works the same and that we're going to all have the same process, it's just not the truth. Yeah, we'll go through that, but everybody's different. And I'm here to tell you, we do not do it all the same. There are similarities to our flow, but it isn't the same. So I need to be trained specific to your practice. So today I can give you like the basics, the foundation of your SOP, but your setup is different and your equipment is different. And if we compare our training protocols or infection control plans, they'll look, maybe, the flow might be the same, but how we define it will be differently. If I take my exposure control plan or infection control plan from one office to the next as I temp, that's how legacy errors occur. And that's how infection control breaches happen. So make it specific to your practice and your equipment and your chemicals. So let's go ahead and create that framework SOP for your sterilization area. So now your Steri Center might not look like this. It might be different. It might be small. It might be in a room. It might be a large U-shape or galley style. The one thing that will stay the same is our flow of how we process through our instruments. I personally love when an office labels things. I do know that some offices find that tacky or they don't like it because patients walk by it, but it helps so much when you are a new hire or you're a temp coming in. It also helps keep teams on the same page. And I tell this story a lot in my presentations, but I once worked in an office and I was a newbie hygienist coming into just graduated. And I walked into the sterilization center and this hygienist, another hygienist, was leaning against the dirty center, writing up her chart where she was like waiting for the doctor. And my jaw dropped on the floor because this is where we put all of our dirty instruments. So she was leaning on the side where all of our dirty surgical instruments got laid, and she's writing up a chart. That's how long ago this was. We were writing up charts back then. And when I was young, I was 22 probably, I was pretty vocal. And granted, I'm pretty blunt and vocal now, but I would like to think I have managed to approach these situations with a little bit more of an improved delivery, because in that moment, I looked at the people in the sterilization center that were not going to say a thing. And of course, my mouth dropped open. And then I was like, what are you doing? I'm asking the hygienist, what are you doing? Do you know that this is the dirty side that we put all of our surgical instruments when they leave the op? Now this chart's dirty. And what are we going to do? Just take it around the office and contaminate everything? And she looked at me with complete shock because she had no idea that's where all the dirty surgical instruments had gone, because she was always in her operatory seeing patients when that happened. And she just honestly didn't know. And then I looked at everybody with shock and asked them why they wouldn't tell her. It was a whole story. It was a whole thing, but it really kind of kickstarted my, passion for making sure that we're creating that nice safety culture in our practice, that we have good communication and transparency without shame. But it also kickstarted my desire to label everything. It was just another way for us all to stay on the same page, and nobody could have that excuse of like, I didn't know. And it really did help create or prevent these infection control breaches, especially in the Steri Center. So some may say that our Steri Center process starts once we enter the area, but I think it starts when we leave the operatory. So I need to know, how am I transporting these dirty instruments from the op to the sterilization center? As a temp, I need to know, because I just worked in an office where I basically turned around and was in the Steri Center. And then last year I was in an op where I had to walk past the reception area where patients were coming and going. It doesn't matter the distance. When you travel from the op to your instrument reprocessing area, you can't just grab your instruments and go, right? Run out. And I know we want to, because we're all in a hustle, right? We're all in a hurry. Are required, our dirty instruments, to be in a bin with a lid that locks, so that if you were to trip or bump into somebody or whatever else could happen, the instruments that are dirty and possibly infectious do not create an injury. So your instrument cassettes do not count. They do not count. They need to go into the bin with a locking lid, and a biohazard sticker they should all go into this container. So it's not the cassette that counts. The cassette goes into the container. I just want to make sure I'm clear with that. So tell me, how am I going to carry? How am I transporting it? And what do I do once I'm done? Do I clean and wipe that off and take it back into the room with me? Or do I stack them and somebody does that for us when we have a time? Do I have multiple in my room? Tell me how that looks in your practice, because again, I have not worked in many places where they're doing it the same way. So I need to know, how am I transporting these instruments? And then tell me what is single use and what is not. Because I'm going to tell y'all right now, this girl has been called some names when I threw out things that I thought were disposable, because the ones I had used previously had been disposable. So I assumed, because no one told me otherwise, that they were not disposable. So I have sadly been asked to reuse and clean and sterilize items that are considered single use. I personally do not play around with this. If it has A2 with a line through it, it will not be reused on my watch, but tell me what is reused. And then tell me what's reusable and what's disposable. And then tell me where I'm going to get rid of the sharps. Hopefully this is in the operatory before I start transporting that tray to the sterilization center. And I've even been in some offices that want to hide the sharps container just because they just for aesthetics reasons. I'm not in full agreement of that, but I need to know, where am I getting rid of the sharps? So tell me, you got to tell me. Now, most items we are pretty familiar with in regards to the Spalding's classification. However, somehow in 2022, I'm still being asked to reuse slow speed hand pieces without sterilizing them between patients. I think at this point that is unreasonable, and it will leave me staring at you until somebody finds me another hand piece to use, because I am not willing to compromise on that as a temp hygienist. But I need you to tell me, because even though yes, there's critical, there's semi-critical, and there's non-critical, there are just some things that kind of like, is this a barrier wrap? Technology gets a little kind of ambiguous as far as what we're supposed to be doing. So I ask that you don't assume that everyone that temps in your practice will know how to take care of your instruments. There are some items that have different instructions for use, and I need to know how I can manage them so that I can prevent these infection control breaches. I mean, obviously, I know that my surgical, or any surgical instruments or like periodontal scalers will always be considered critical instruments, and they should go into a heat sterilizer or some kind of sterilizer. But then when our semi-critical items, again, like our X-ray sensors and things like that, it's a little all over the place. So tell me how to manage the items in your practice according to the instructions for use from the manufacturer. And these items tend to be that are a little kind of like all over the place and are different in every office that I've been to, have been more like the electronics or the multi-use items. And I need to know, how do I barrier these and where do I find the barriers? How do you prefer those to be disinfected? Because I have just recently was in another office that had two types of disinfectants, one for certain items and one for another item. I'm like, okay, if it's not in writing, how am I supposed to know these things? So we want to make sure that I know how to manage your equipment so I don't cause this very expensive stuff any harm or damage. I just recently also saw somebody, they were barrier wrapping the RIN holders. So I normally autoclave those, but they were barrier wrapping them. I've even seen some people that put those in cold sterile. I have some people who won't put them in the ultrasonic. They'll rinse them off and then they will put them on a very specific rack in the sterilizer. Not every office does it the same way. So I have 100% melted a few X-ray holders or two in my time. I want to say I have some remorse for that, but I had no idea because nobody told me. So give me some more details about your instruments. And if I am the one processing those, make sure I am not ruining anything. Again, I ask questions, but if it's in writing, I don't have to bother anybody. And I would be remiss if I didn't bring up PPE. It's not just for the ops and for patient care. I would make a case that this is one of the most important places to wear proper PPE. We are exposed to everyone's dirty instruments and also to so many chemicals. We really can see the many types of hazards we're dealing with in our profession. In this area alone, we have the biological, we have chemical, and we have occupational hazards happening here. It can be a dangerous area to work in. So how do I protect myself and where can I find these items? So what PPE do I need as your temp today? And I'm here to tell y'all I'm a petite person, so I need extra small everything. Do y'all have that? And that includes utility gloves, cough, utility gloves, those thick puncture resistant, heavy duty utility gloves. They should 100% be worn when transporting and cleaning contaminated instruments. So please have those available. And If you don't want to have them available for like every size that might come into your and temp in your office, they do make a disposable version out there. Those are the ones that I like the best because they fit my hand the best. So, just be creative. Go make sure you have those the appropriate PPE, especially for the instrument reprocessing area. This is very important. So I mentioned earlier, like we want to train specific to your Steri-Center. Even though we all might have a very similar flow, it might just look different. But our instrument reprocessing should, no matter what, happen in 5 steps. So we are going to receive our instruments. We should have an area to receive those and decontaminate them. And then they go into a cleaning, rinsing, and drying phase. Then we're going to inspect and package, and that includes our chemical indicators. Then we sterilize, and then we store. And so, yes, it kind of happens in this flow, but some people's might be very distinct. Like you have one entire side of the wall that is dirty area and another side that's all clean. And you might have it all just happening in 4 cubic feet of each other. I don't know how, but like very small areas. But you can make sure that these are isolated and the flow is happening. It does not matter how big or small it is. It does need to happen in this way. And I have walked into a practice where I was like, I don't even understand the flow. This is an example. So yes, this is a Steri-Center. It's all the stuff that I think we're all used to seeing. But in this particular case, they were receiving instruments here. There was holes for trash and everything. But then I walked it past the autoclave and then we put it into this ultrasonic. And then it got rinsed and dried, which I'm still confused how things were drying in a sink where things were being rinsed off. But that was their rinse dry area. And then it was pretty much the packaging area, which is fine. Like you can be efficient with this with small spaces. But my problem was then we took that packaged items and we brought it back over to where I just had received everything to the autoclave for it to be sterilized. And then once it was sterilized, I brought it on over to the other side and put it in the drawers to store. This is very possible to switch some things around to make sure that the flow makes sense. But you can see as a temp coming in, I'm like, I guess I can look at it and take a minute and figure it out, but it was just not efficient and not effective. So you want to make sure things are happening in that flow. So there is no cross contamination. So things that are walking past the autoclave to the ultrasonic, that was just too much for this particular situation. And if you're not able to process your instruments, we don't want them to sit out and dry. This happened a lot when I was working in a surgical practice. And let's say, a big bone graft implant case came out of the op and they had a lot of things to process. So my instruments kind of just sat to the side as they were, cleaning out their implant burrs and doing all the things that they needed to do to process after that surgery. So I personally use an enzymatic spray. I will spray my instruments so that they don't get dried out, that bioburden doesn't shellac onto my scalers. So if this is what's happening in your practice where you do notice things or you're just busy, again, we're shorthanded. And so you're just like cleaning ops, tossing them in as you're going. And when you get a chance, then you go back into that Steri-Center and you process everything. You can even spray this down in the operatory before you start transporting them, especially if you're just going to put it to the side and no one's getting to that anytime soon. You could also have even a pre-soak, which it could be even just soap and water sitting to the side where you put your instruments in there. We just don't want things to get dried so that we don't have to scrub our instruments, because if we have to scrub our instruments, that opens us up to more percutaneous injuries. So just know that there are options for a pre-soak or enzymatic spray if you find yourself being so busy and so shorthanded that the sterilization and the processing of those instruments kind of takes a back burner until somebody can get to it. But also tell me what the flow is. Like, am I responsible for start to finish? Like, do I need to make sure I hear that ultrasonic stop and come and get my instruments out? Or is there somebody that's going to be doing that? Or are we just kind of working with, like, if one's in there, I rinse it off, it starts drying, I put mine in. Like, tell me what that process looks like. Because the instruments do need to go through a cleaning process first before they're sterilized to remove that bioburden from the instrument so the surface can be sterilized. I mean, we got to do that, but that might look different for each practice. So if you're using an ultrasonic, tell me how yours works, because believe it or not, y'all, just tossing instruments in and turning that dial on does not always create clean instruments. I haven't worked in an office with an instrument washer in years. So if you have an instrument washer, I think that's pretty cool. And I'd love to know how it works. So tell me what that process is. Tell me, how do I load it? If I load it, am I the one who needs to turn it on? Or do you guys wait until lunchtime and you run them all at the same time? Like, make sure that I know how this works. It does not take that long to write out these instructions so that I don't have to go annoy somebody, or they get annoyed with me because I'm messing up the flow of the day. Also, what's your workflow for inspecting or ensuring that bioburden has been properly removed and there's no damage to your instruments or no issues like rust before we package them? So when I package them, what chemical indicators am I using? Are they built into the package? Which ones do I need to put into cassettes? Tell me how I can help you know that later on, when you open up a package or of instruments that I packaged, that they are sterilized and acceptable for your next patient. So tell me the protocols for your inspection, your packaging, and what chemical indicators I'm using. And I did write an article about chemical indicators back in 2021 with RDH. You're welcome to go check that out. There's quite a few of them out there, but there are 3 ways to ensure that we are monitoring our sterilizers. And one of them is chemical monitoring. And that is done with these chemical indicators. They can be both internal and external, and they use sensitive chemicals to assess these physical conditions like the time, temperature, and pressure of your sterilization process. And although chemical indicators do not prove sterilization has been achieved, they allow detection of certain equipment malfunctions, and they can help identify any procedural errors. External indicators apply to the outside of the package, so like your indicator tape, and then internal indicators should be used inside each package or cassette to ensure that any sterilizing agent, most likely steam, has penetrated that package and material and actually reached the inside of those instruments. I also highly encourage you to place a Class 5 integrator, which is one that measures time, temperature, and pressure. Make sure that that's met, that you put one of those into every load. This will help you ensure that your equipment is meeting all of the parameters between your spore test, which should be happening at a minimum of 1 time a week. And again, this is a critical step in patient safety. So we want to confirm that our equipment is working. And also, I know how to tell you your equipment is working. And just so you know, there are 6 types of chemical indicators. So you want to know which ones you use and which are recommended for your equipment. You can find more info probably with your equipment's instructions for use, and also with your instruments instructions for use. I know I mentioned this already, but I prefer a type 5 integrator in every single load in combination with a type 4 indicator. If you're using wraps, like you're wrapping them, your cassettes, remember a type 4 needs to go inside of the cassette. And if you're feeling really spunky and crazy, I love the idea of putting that type 5 inside your cassettes, especially surgical cassettes, because that type 5 is going to tell you it's met all the critical variables. So your time, temperature, and pressure. But I need to know where are the chemical indicators? Where am I putting them? What's this look like in your practice? Because some of them could be built into your packaging. Some of them might have packaging that are just going to measure temperature. Maybe that's just one factor. And so I need to put something inside to make sure that again, your sterilant, if that's steam, most likely steam autoclaves out there. I know a lot of them are so using those, that steam has actually penetrated the package. So tell me these things. And then tell me what to write on your package. And, is it a stamp or is it a marker? Do you want me to write out my name since I'm temping? Or do you want my initials? Is that okay? Do you have a stamp for the date? How do you mark what sterilizer will it go into? Some people will say sterilizer 1 and sterilizer 2, and they know that that's their autoclave and their flash sterilization. Well, I might just write on their flash sterilization because I don't know what you're calling it. So just tell me what I need to mark on there and make sure that I know how to mark it properly. I also really love when offices are using color-coded systems, because again, if I am somebody who is very unfamiliar with some restorative things and there's a color coding system happening in your practice, it makes me help you so much easier. So maybe somebody canceled and I can actually unload that autoclave, but I don't know where half these things go. If I know blue cassettes or restorative kits or cassettes, and I know blue bite blocks are for restorative, then I can put all of those together and find the cabinet labeled restorative. If I know that the hygiene trays are all purple and the cassettes get put on the trays, like I can follow a color coded system. So I just like to make, I'm just an advocate for that, especially as somebody who has worked in a transient clinic and also temping in all these places because they all look different. And then I need to know how to load your autoclave. And again, I know I said this already, but if I had $1, even if I had a dime for every time somebody asked how, is it paper up, plastic down, I swear I could be retired. I'd just be doing these webinars for fun because not all of them can be loaded the same. So you got to read your instructions for use for the autoclave. There are some now that are being stacked on the sides. Some are paper up, some are plastic down. Just know how to load your autoclave and make sure I know how to load your autoclave. And I did just want to highlight a few reasons for errors or common mistakes with instrument reprocessing as far as failure of your spore testing or failure for not all of the instruments to come out dry or not see all of your chemical indicators turn. A lot of it's not equipment malfunctioning, it's human error, because we are humans and we're going to do that. So just make sure that you're not overloading that chamber. Make sure that they are spaced out. There's enough room, that you are using the correct program for your autoclave with the correct packaging. So you just want to kind of make sure you're not doing all of these things before you assume it's the sterilizer and the issues with that. Also, tell me about your cold sterile. I really am pushing people away from cold sterile or glutaraldehyde because of situations like this where I open it up and I'm like, so we're calling me sterile or what's this situation? So if you are using a cold sterile, tell me what goes in there. Tell me who's emptying it out. Tell me if I need to do that in the morning, where's your sterile water to rinse these off with? Just tell me about that cold sterile and what the process is for this. And then tell me how you work your autoclave, because they are not all the same. I actually was just in a practice that took me way back to hygiene school, which was decades ago at this point, somehow getting close to two decades ago. But it was one that it was an older Tuttenauer, and you had to fill the chamber. You had to wait till that water reached a certain point. And then you turned it off and shut it and closed it down. And I was like, oh my gosh, I haven't done this in 15 years. It's been so long. But everyone was busy. The assistant was out. So somebody needed to start the autoclave because I needed instruments for the afternoon. So I had to figure it out on my own. But thank goodness I had some experience, granted many, many years ago, but I had a memory of how to do this. I need to know how to work your autoclave because they are not all the same. And even some of these newer fancy ones, I'm like, oh Lord, like this is so fancy. Like, do I just press buttons? What do I do? They don't even look like they used to. So I'm excited to see the new ones, but I need to know how to work it. And I need to know how to keep records in your office, because record keeping is required and you will be asked for this if you ever go through an inspection. Everyone should know where the records are kept and how to record the info. You need to document everything. And I know this feels tedious, but to go back to my original comments about how important an ICC is, an infection control coordinator is, this is providing time, not like in their schedule, so that they can keep track of these records, because they are so important. I will say that dentistry has gotten very lax in this way, and performing these tasks and documenting our quality assurance is critical to patient care. So tell me where I find the log for the load information. If I pull out the spore test, do you want me to record that? Or do you want me to just like put that to the side? Like the assistant told me, don't touch your stuff. I'm like, I got you. I won't touch your stuff. But if I find this thing in there, because I know it's Monday and we do spore test on Mondays, what do you want me to do with it? How do we monitor if the sterilizer has reached the proper time, temp, and pressure? Is there a printout, or do I need to document this? Like what's the protocol here? If it wasn't written, it wasn't done. And the auditor isn't going to care that the days that are missing in the records are the days that a temp came into your practice. They're going to wonder why you didn't teach me how to properly record this important information that ensures instruments were being processed properly. So make sure I know how to keep records so that you can stay in compliance. I just wanted to give this as like an example. This is from OSAP, osap.org. That's osap.org. They have some like this little document of maintenance records that should be kept. Again, this will be where your infection control coordinator can help you and provide continuity in your record keeping, and also why you need to allot the time for your ICC to stay organized, because this is a lot of things that we just want to make sure that we're keeping record of. And where do I store items? Are they just like stored in drawers where I just toss them in there? Hope that none of these instruments poke through this bag and we're not going to have to reprocess these instruments. Does like the hygiene, is there a hygiene cabinet that I find things, or are my hygiene items stored in a room? Do you have them nicely placed and like labeled in a certain way so that I can just grab and go? Like, tell me, where do I store the items that are coming out of these autoclaves? Because I do want to help you. I want to help process these instruments. If I'm done early or my patient cancels, like I want to come in there and help you, because I know we're shorthanded. So tell me, where do I store these items? But this goes back to that color coding system. Man, a color coded system is chef's kiss. It's amazing. But what I don't enjoy seeing, y'all, is when I like open up a cabinet and there's just a basket of randomness. And then I got to figure out what it is, where to find it. Like I'm looking for ultrasonic tips and they're like, oh, she keeps them in her room. Okay. And then I had to go on a scavenger hunt for that. So I think organization, labeling, it's critical, and it really does help us in this time right now that we're all living in, where we're all shorthanded. Oh no, someone is out sick and it's time for our ultrasonic testing and our spore testing and our instrument inspection and our autoclave maintenance. And, I got to keep records of all those things, or the rest of the team is busy. And again, somebody canceled on my schedule. I want to help, but I don't know how everybody tests their ultrasonic. Some people might test their ultrasonic with the good old tinfoil test. Some people might be using vials or little things that you can put into the ultrasonic. This is super important to be doing, y'all. Again, I said earlier, I think we all get into this habit of where we just toss our instruments in after we filled the ultrasonic, and we turn the dial and expect them to be clean. There is a science to the ultrasonic too. The amount of enzymatic cleaner, to water, to the temperature of the water, to degassing it. I've even been, working with an ultrasonic where I did not I hear it running, but I didn't hear the transducers. One of them had gone out. So the other one's just working overtime, but only half of the ultrasonic was actually working. but it sounded like it was working. So I thought it was working, but if I didn't test it, I wouldn't have known that it was an issue. So, we want to make sure that I know how to help you with your ultrasonic testing on Monday morning. Maybe that's when you're doing it. It's Monday. It's sport testing. Do you do mail in? Do you do in office? Do you have somebody designated to go through and make sure that all your instruments have been properly run and that all the chemical indicators are turned the way that they need to be turned, and the instruments that have hinges are open, all the things that you need to do? That's very important. We should be doing those things. Can I help you do that? Is it the day to autoclave? The maintenance needs to happen, but somebody's out with COVID and that might not happen for 2 weeks? Well, if I have a patient cancel, let me help you. But where's the instructions? Where's my standard operating procedures? Because I can follow bullet points if you just show me where I can find those. And then let me help you keep those records. So, we want all of this written out, because even if I am a regular team member, even if I am somebody that is, your hygienist on a regular basis, but you have team members that are out sick, or God forbid, got in a car accident or something crazy, because all that happens on Monday morning. The computers won't work, the ultrasonic's not working, somebody's out sick, there's traffic, the bridge is up, whatever, right? That happens. If I am there, let me help, but I can't help if it's not written out. And this is also where I think we get ourselves into trouble, because we have had a lot of team members not come back. And then we're all going, well, she was doing sport testing. I don't remember the last time sport testing was done. But if we have SOPs and we have good record keeping, the office can keep on practicing safely. And this is just from, again, OSAP. They have a little checklist for these repeatable processes. And again, that could be your standard operating procedures. And then you create just a little checklist that you might keep in your Steri Center that can just be a quick reference. They're super important to write out. I'm also a big fan of the book Checklist Manifesto. If you're nerding out one day and you want to read up on how to create really good checklists, that's a good one. But for SOPs, a checklist will be your friend. And so this is just kind of my final plea for SOP. Please create these. I picked the sterilization center because I do believe that is a critical aspect of patient care. Again, just because I know how to be a hygienist does not mean I know how to create safe, properly sterilized instruments in your practice. So tell me how to do that. And this is an example of SOP. This is from the University of Oklahoma Health Science Center. And it just kind of, again, it just states the why, the when, the where, the how. You want to give the purpose, you want to state the objective, and then write it out step by step. Tell me the chemicals, tell me how to do it, tell me where to find that stuff. That way I can do it with a blindfold on. So I really hope that if you are struggling with a team shortage, that you find the time. I know it might not be, Rome wasn't built in a day, especially when we're short staffed, but finding those moments that you could just take one thing at a time. Maybe it's operatory turnover. Maybe it's your the spore test. Maybe it's an aspect of your sterilization center. Write it out. That way that we can all follow it. We all get trained properly. But if somebody's out that is usually in charge of that, well, don't worry about it. We have it in writing. And so I just want to say thank you all so very much today. I know that I have some questions. If you have more questions, you can use that Q&A section here, and I can go through these. I really do appreciate your time. And if you are struggling with staff, I hope that, I hope it all gets better for us all very quickly. Let's see. One of the questions. Why did 2 sterilization pouches have red X and 1 have a green check? Are we supposed to write on the plastic and not the paper? Great question. So you should be writing on the plastic. That is what a lot of people are saying. I am now starting to see some packages come out where the lip that folds over with those that perforated section is actually having a date and information for you to fill out. So you're filling it out on that little lip. I definitely have been taught that it should be on the plastic and on the tape because the ink can actually come through the paper part and get on your instruments. I have, yes, when anything I tell y'all, like be careful about, I've probably screwed it up in my 22 years, like at some point. And I have written on the outside of the paper and that has gone through and like stained a handpiece of mine. So you should write on the plastic part of it. And you should also write on the tape on the woven fabric type of sterilizing paper. Also, that is why you want to clean your autoclave on a regular basis, because that ink does it kind of once that steam interacts with it, it can get on the outside of the autoclave. It can go get in the filter. It can on your temperature gauges and stuff that are in the autoclave. It can actually kind of create a film over it. So that's another reason that you want to routinely clean your autoclave. So hopefully that answered your question there. Somebody else asked the same thing. I saw the writing on the back of the sterilization bags were incorrect and the writing on the plastic side is okay prior to sterilization. So what about post-sterilization? I guess my question is, what are you writing on that post-sterilization? Because we want to know like what load it was and all those details before we put it into the autoclave. We want to make sure we're putting it in the right autoclave and that we're not doing that after the fact. So I guess, I mean, if there's just small details that you're writing on there, I'm not sure what those would be, but most of the time we want to write it on there before we put it into the sterilizer. Somebody asked, can you review the aluminum foil test and the ultrasound cleaner? So there's actually quite a few videos out there on YouTube. I have one with a Tale II hygienist. I prefer the other products that go in there because there's these vials that actually have ingredients inside of it to make sure that it would remove bioburden. These ultrasonic the tinfoil test and the ultrasonics are just telling you if the transducers are working. And so essentially you put a piece of tinfoil. I personally hold it there for 1 minute. You don't touch the sides or the bottom. You get it just short of the length of the ultrasonic. Again, you just hold it in there. And then when you pull it out after a minute, you're looking to see if it's pitted all the way across. In my situation where only half of it was working, I only saw pitting on half of that tinfoil. So again, you can find YouTube videos on that too. Let's see, how long is it to sterilize instruments that are not used frequently? I'm not sure what that actually, how long is it recommended to sterilize instruments that are not used frequently? We used to go off of something called event-related storage. There are some packages that will have a lot number and expiration date on them. Not all of them. I think they follow more of the event related storage, meaning that if it didn't puncture, an instrument didn't puncture through the package, or the package didn't get wet or damaged, or wasn't in a procedure where it potentially was contaminated on the outside of that package, it's considered sterile. However, if you do have any of the packaging material that has an expiration date, then you should follow that. I also know some practices that will put that date on there, and if it's after a year, they will re-sterilize those instruments. Initials and date should definitely go on the outside. Initials, date, the autoclave number, if you have more than one autoclave, and the load number of the day. So if it's the first load of the day, second load, third load, that way, if we were to fail anything or we notice that type 5 integrator didn't turn, then we can quarantine that day's worth of instruments too. So we want to put the load number for that day. How long is it estimated to sterilize instruments that are not? Oh, I think I answered that one already. I'm supposed to put the packages into the autoclave. Someone's asking if we're supposed to put the packages into the autoclave, paper up or paper down, and I will send you my Venmo for more money, please and thank you. So I don't stress out. Any other questions? Please don't hesitate to type them in here. I will stay on for just a few more minutes. And if you have any questions, you're welcome to connect with me, Michelle at levelupip.com. And again, I want to thank Tuttenauer for the opportunity to chat with you all today. And hopefully you don't have a lot of temps coming in, but if so, then you have so many great standard operating procedures, and it'll just be super easy for them to practice safe dentistry with you and your patients. So thank you all, and I hope you have a wonderful night.